The Royal College of Nursing is a professional body as well as being a membership organisation in the United Kingdom as well as having members abroad. A majority of its members are nurses, but it also has some healthcare assistants as well as student nurses as part of their members. The RCM represents the professionals' interests of nursing staff and are there to provide support when needed. The Stewards, safety reps and learning reps will represent members across the UK, and they will offer members free confidential advice on employment matters, career development and many other issues that may be needed. Evaluation of the effectiveness of the multidisciplinary approach. The multidisciplinary approach is made up of members of the multidisciplinary team, or MDT. The team is made up of several different professionals who may be involved in the care needed for the person. The team is assigned to a patient, and within this team, they will explore many different diagnostic approaches in order to reach a formal diagnosis. The MDT team includes consultants, doctors, physiotherapists, pharmacists, specialist nurses, pain team, discharge coordinators, nutritionists, occupational therapists, and many others that may be involved in a certain person's team. If an individual is under a specific nursing team, they will also be there at the meetings. From this, they work as a team to provide time-efficient, excellent care for the patient and inclusively come up with a care plan for the individual, including any future treatments and care plans that may be needed. The team has to be aware of their own roles and responsibilities so that care doesn't lap over or get missed or forgotten. A nutritionist will provide information on what the individual should be eating and how much and how often. A physiotherapist will be advising on what sort of movement the patient can do, how often and where this can be done. A social worker may also be involved, dependent on the care. The positives and limitations to the multidisciplinary approach. The benefits include the patient has less waiting times for any appointments, diagnosis and results, that is all done within one team, who then normally the consultant or an appointed person of the team will feed back to the patient on any findings that are found. It can also help to lower how long a patient is in hospital for, as communication is well done. All the information is accessible more easily, as the person you wish to speak to will be in the team meeting with you. So any problems you may have with a certain area, you would then be able to discuss it with them at this meeting. It allows for the patient satisfaction, as the patient feels like everyone is interested in their care. So they know that this meeting would be happening, and they know that all the different members are there to help provide a diagnostic approach for their care. It improves the patient's care and outcomes through agreed treatment plans. So the patient is then given a treatment plan that everyone has come up with and that they are going to follow. Services and plans aren't duplicated, as the person is discussed one at a time. Within the meeting, everyone is discussing the certain points that they have for this person, and because they are all present at the same time, then care is not overlapping and duplicated, and communication is kept to a good, satisfactory manner. It also allows for healthcare professionals to learn about other health professions and the job that they do. So a person may be there that doesn't know something about another job role will then learn about what they are doing, not just within this MDT meeting, but as a job profession. It doesn't always have to be face-to-face. This meeting can take place over Sky, sometimes with group telephone calls, and it allows for members who are in different parts of the country or for a input from somebody that may be based at a different hospital to also be present within this team. So the limitations include a lot of people have access to the confidential information. So does this mean that information is kept confidential with so many people knowing it? Hopefully, yes. The patient isn't involved. So the patient will not be present at their own MDT meeting. It is only for the healthcare professions. And also their relatives are not invited to be present. Normally the meetings aren't known to be lengthy in process. However, I'm sure this would depend on what the diagnosis problem is in the beginning. It can cause time pressures. So all the health professions are extremely busy. So it can mean that they are pressured into coming to these meetings and that they are not managing their other workload effectively because they are in this meeting. Attendance isn't mandatory. You should attend these meetings if you're part of the MDT, but it may not always happen. So you will miss out on some of the information, or they may not be able to consult a certain person because they are not present. The team may not communicate. Communication is vital within the MDT meetings, but sometimes this doesn't always happen. So things get duplicated, things aren't heard, and vice versa. Is the multidisciplinary approach effective? Yes, if it is carried out effectively, where all the members of the team are present, they are communicating well, and everyone understands what their roles are within this team. The benefits outweigh the limitation, as the patient and teams have so much more to gain by conducting them. By having so many professionals involved in an individual's care, it allows for them to be cared for effectively and quicker. All in all, this improves the overall patient care and outcome. Thank you very much.